it's great to see you again. And I had a question for you, just
Sure.
as we sit in this conversation. Would it be okay if I call you Dr. Sam?
Absolutely.
Would that be all right?
No problem.
I know you're a family man. And when your kids were little and they said to you, Dad, I know you're a doctor, but what do you do? What did you tell them?
Well, my kids thought Sam Weinstein, MD, meant Sam Weinstein, my dad. Basically, I've had a few different jobs as a physician. My last stint, 16 years clinical as a associate professor of cardiac surgery, I was a pediatric heart surgeon. So I would tell them I fixed little kids' hearts.
Yeah, not a bad answer. I fix little kids' hearts. But I think to them oftentimes what they like the MD, my dad.
They still do.
Dad. When you're a young man and starting to witness some, I'm sure you studied under some great physicians and healers, met some fabulous nurses. Mm-hmm. Was there one in particular who you witnessed conducted themselves in some manner that really drew your attention and said, I like that spirit in that person?
There was one time that it struck me, the human side of a physician who was really well known for his expertise in mechanical assist devices, almost the opposite. He was very technically driven. And this was in the early days of mechanical assist devices when they may not have lasted terribly long. They create a lot of patient complications, and sometimes the devices themselves would fail. And when that would happen, the patients would not survive. And so there was one time where I was on the floor in a patient's wardroom with this surgeon and a team full of people when the machine was failing, a left ventricular assist device. And the patient, who had really had a tough time, had recognized, along with all of us, that the machine was not going to be able to keep going. And the look on her face was staunch. And at that time, we had really nothing else to offer. And so the attending physician, a cardiac surgeon, sat down on the edge of the bed, and he just stroked her hair for the 9 to 10 to 11 minutes till things were over. And she relaxed. And she closed her eyes, and it was all that he had left. But at that moment, it was everything.
Sometimes in our life, caring is all we've got left, and it's just no one loses the impact in the sense of the impact of caring. Caring is healing.
He got, even though he was a master at working with machines, that at that moment all he had left to offer was himself, and just some mild human contact and uttering small reassurances to her. And I've never forgotten it. And when given the opportunity, I've tried to emulate that behavior.
I think a lot of people think of physicians and nurses, that this kind of distance concern, so you don't get too caught up emotionally. But there's a huge requirement for healers to reach into themselves, to find some place where they can find some aspect that can do beyond all of the training they've had, but it requires, and that's always most amazing to me, because it seems to run against what people think is the personality of someone in this position.
I think so. I think everyone handles it a little differently. I think some disconnect because they're not comfortable with the emotional side. I think those who are more comfortable can display that. But it's tough today, especially when you're a surgeon and in an operating room. You have to have some sort of disconnection when you're actually operating on a patient, and when that ends and where it ends can be challenging for people. Does it end at the door? Does it end upstairs? Does it end where you go home?
Yeah.
And not all patients and physicians understand that.
And at different times in your life, the old Heraclitus, no man puts his foot in the same river twice, not the same river, not the same man. So where you are in your own evolution, so you, in the sense of evolving as a physician, as a healer.
Everybody's a little bit different. I remember the physician who treated my grandfather, after he passed, told my father, everybody that passes takes a little piece of me. He said, and if I was not all in it at the end in the conversations, it's not because I didn't love your father, it's because when I see what's coming, I have to protect myself. And I'm not telling you it's right, I'm just telling you it's what I do.
Right.
So we as a group understand what the physicians go through. We understand not just the stress of dealing with the patients, but the stress of the procedure, how the hospital is demanding, how the state and regulatory agencies are demanding. We need to be there for them, to take care of them, to make sure that they have all the tools to be comfortable and successful.
Well, to that end, here you are with a number of major successes in your life. Here you are now the CEO of SpecialtyCare, Why now? Why this? What are you hoping to bring together here that is yet the next stage in the evolution of, if you excuse my expression, a great Dr. Sam? What is the next step in the evolution of this? Help us understand a bit, will you?
I was looking at a number of different opportunities when I left my clinical practice, and I really feel like specialty care pulled me. When I think about in my practice, the impact that the technicians and support physicians in the operating room had on me, it was exponential. The physicians who were reading studies while I was taking tumors off near the spine of a child, helping me keep them out of injury. Or a perfusionist who was there to help me rescue a patient who was in cardiac arrest. Or a surgical assistant who changed their vacation schedule to help me do a case on a Friday because they knew that I would be more comfortable with them in the room. These things are parts of my practice that don't always get shared with the patients or the families, not even some of the physicians who are in the OR who don't understand the contribution that these people make. But it's enormous, and the OR doesn't run without them. And I know that, and I mean, I love these people for what they've done for my patients. I love them for what they've done for me, and I feel that it's my mission to help them be better at what they do, support them to be better at what they want to do, and make their careers as fulfilling as possible.
I think when I hear you say this, I realize as a head surgeon, you're always involved with teamwork, building a team around you. And now in this role that you're playing, you're building team around you. Is the idea of building camaraderie, is there some magic touch to that, how one builds camaraderie, do you think?
I don't know about magic touch, but I think attention must be paid to it. So, you know, in my example as a heart surgeon, there might be 8 people in the room with you. The patient's family generally thinks of the surgeon, but there might be 2 anesthesiologists, there are always 2 surgeons, there are 2 perfusionists, there are 2 nurses, there may be cardiologists, there may be other folks in the room. And they're all there to help the patient. But we all need to work together, and some of the days are long, sometimes they're not getting the credit for that, sometimes the outcomes are tough, sometimes the outcomes are easy, but again, when you see the look on somebody's face, when they've made a contribution that goes at that moment unrecognized, at the end, you give them an attaboy or an attagirl, the light up, the way they smile when they know that they've not only helped the patient, they've helped the doctor, you get a double win for that.
I think that's exactly what makes you feel you've lived a life worthwhile.
You can make the difference on more than one person at a time. There are times when you're managing the patient, and there are times when you're managing the team. The team provides such a vital role, they need to be taken care of. And that's one of the things I always enjoyed when I was a practicing clinician. It's one of the reasons I wanted to move over to this company, and it's one of the things I enjoy most about leading here, is I get to help thousands of people who touch the lives of hundreds of thousands of patients. And that's really special.
And those in turn influenced lives of over 1 million people in the last year or so we were talking about it.
Right. I mean, if you think about touching one life, so what circles a person? It's their family, it's their community, it could be their children, it could even be future generations. You're talking about well beyond dozens of people. You think about touching one person, you may have helped 40, 50, or hundreds of people who are all associated with that patient. It has real exponential proportions.
Absolutely. We were talking last night. In Scripture, it reminds us when you save one life, it's as if you save the whole world.
That's right.
In some level, it really plays that way. The great Arnold Palmer liked to say, the more I practice, the luckier I get. Right. I know that the quote from Calvin Coolidge has been something you take to heart. That at the end of the day, there's nothing that can replace persistence. You want to talk a little bit about why this resonates with you and what we're doing here?
Well, it was my mother, who was an English teacher, who first shared this quote with me, and I've had a version of it on my desk since I was in high school. We actually have it on the walls of our company. Calvin Coolidge had commented that really what makes the difference between success and failure is persistence. Talent alone doesn't get you there. We all know lots of people with talent who can't work their way through a lot of situations. Genius is not. Unrewarded genius, Calvin Coolidge said, is almost a proverb. It's really persistence and determination alone that will get you from here to there. Because it's not that we've failed at anything. It's that we haven't figured out yet how to succeed. And you never get there if you don't persist.
So there's, my sense is that very few of us are lacking for information. What we're lacking is the character to act on the information at hand, right?
Absolutely.
And so this is persistence is under this quality of character.
Right. And I tell all the young people in our company that are coming in and people who are interested in training in our company, and to be honest, anybody who will listen, that this is what makes the difference. We all have access to the same technology. We all can have access to education. What's going to separate you from everybody else? It's really the effort. And it's not that you have to give an effort better than anybody else. You have to give your best effort.
Your effort, yes.
Right? You don't have to win. You have to try to win. And what I was saying before was, all you can do is all you can do. But that's usually more than enough.
Indeed it is, and it's one of the shadow qualities that so many people are prepared to give so much less, and it's one of the real coming together qualities of so many people here at Specialty Care, right, because they're looking to give more.
Well,
if I might, I think
absolutely, and I want to help them. We want to help them give more, because when you see the look on one of our employees that have not just helped save a patient that day, but have helped the surgeon in the room and knows that that impact is going to last not just for days, but literally for generations, and you congratulate them and you let them know that they were a vital member of that team, well, you can just see by the look on their face that that's something you hope that they really appreciate, and actually you hope that everybody can experience.
Yeah. Once people know that they matter, then the world around them matters.
Absolutely.
Right? And doing this here is how a team matters. That's the thing that's amazing here, because there's no, there's no I, like Johnny Wooden, there's no I in the word team, right? This, like, the team matters, and everybody picks up their own self-worth out of being a member of that team.
We thrive on being vital members of that healthcare team. It's our mission to help the surgeons in the hospitals treat those patients as efficiently as they can, efficiently medically and efficiently economically. That's how we're trained, and that's our focus.
I think people tend to forget that while the patient is always under a state of tension because of why they're in that circumstance, right, the physician also has a state of tension. It's not a tension that immobilizes the physician or the nurse because they've had experience on it, but it's tension the same way as people get excited before they go on when they're entertainers. They hone their own edge with the tension. You get better because you want to make sure you do not make a mistake.
Well, I think that's true, and I would add on to that I like to tell all of our employees, and especially all the new hires, that you don't really, we do great work. Mm-hmm. You make your reputation, or you make your real impact when it's a difficult situation. I don't ask or hope for anybody to be in a difficult situation. But when the situation is challenging, that's when we, Specialty Care, our people, are at their best, because that's when you need to buckle down, think through our training, follow our protocols, communicate intensely, and make sure that we stay in it till the end with the surgeon or the neurologist or whoever we're working with at that moment, so that we're maximally contributing to support what's happening. Because when it's over, you've got to be able to say to yourself, I've done all that I can do, and all you can do is all you can do. And then when it's completed, it's the responsibility, I think, of the surgeon, and now for me as one of our company's leaders, to let people know that they did a great job. That just because the outcome wasn't where they wanted it, it doesn't mean they didn't have a huge impact. And sometimes they'll be able to help turn things around. But when you've given it everything you've got, yeah, we all recognize that. And if you hang in there professionally, that's what makes their reputation individually, and I think that's what makes our reputation as a company.
I'm absolutely convinced of it, and I'm convinced that it's one of those truths that plays on many, many platforms. This great acting coach who taught Marlon Brando said to him, play the part, not the result, right? Do the work, not the result, because if you're playing the result, then you're playing ahead of yourself, and you're not in the game. I have a friend who was a very famous pitcher, and I asked him one time, I said, how did you deal with having 65 million people watching it? He said, I never saw 65 million people. I was just playing with the catcher, right? You're staying in the game. That's a challenge.
That's exactly right. You know, people like to say you miss 100% of the shots you don't take. The way I interpret that is, you have no chance of winning if you're not trying. And you don't have to win, but you have to try to win all the time.
To that point, here you are, have achieved this, a lot of stuff in your life. Here we're heading up a great company and what we're doing and building a fabulous team here. If you were going to tell people what you think is the abiding lesson, right? Some message to the next generation. I'm not making you, you're a younger man than me, so I can ask you this question. If you're an abiding lesson to the next generation or people who would come in to our field here, when I said people who are committed that their mission statement is to be caring and healing, what would you say to them? What would you say to them is like, hi, I'm Dr. Sam. I've spent a long time doing this, and I've had some achievements, and this is what I've learned.
Well, I think what I would say is that as technologically advanced as society and healthcare gets, the things that distinguish us as care providers is what we contribute as people. Anybody can look something up on a phone, anybody can search on the web. That's not really what makes the difference. What makes the difference is our persistence and our contribution to others and to thinking of the project, not what it means to us, but what we bring from ourselves to help other people. There's no substitute for that. For all the business opportunities, for all the medical opportunities, for all the sophisticated forms of communication, there's still no substitute, fortunately, for being in the room with someone, shaking their hand, laying hands on a patient, or just listening.
Of all the things we can make in life, why not make a difference? Dr. Sam, thank you for making a difference. Thank you for making a difference.
Thanks for your time today.